Today we're going to talk about headaches and migraines, and I'm Dr. Julianne Murella. I will, in this side, I'll talk about myself. So I am a naturopathic physician as well as a licensed acupuncturist. So I'm often combining both Western and Eastern medicine in all of my visits. My passion that got me into naturopathic medicine has been primary care, and I love the integrative approach to primary care. I do acupuncture and Chinese herbs. My interests lie in chronic diseases, women's health, GI disorders, physical and sports medicine, and IV therapy. And today I'm mostly going to be focusing on the physical musculoskeletal aspect of headaches and migraines.
Hi, everyone. I'm Dr. Nina Paroo. I'm a naturopathic physician and have been at Holistique for just over, I think I'm going on 7 months now. I've been in practice for almost 19 years, and my focus primarily lies in chronic disease, integrative primary care. I use IV therapy. I also use tools such as biotherapeutic drainage and employ cellular detoxification modalities.
Okay, so we're going to get into this. So first and foremost, please note that headaches is an umbrella term for many different types of causes that cause head pain. And so we're going to talk about the different common types of headaches. And so one of them is migraine. And so migraines are the 6th most disabling disorder globally, according to the WHO. And actually, in this study to the right here, it talks about the lost productive time and cost due to common pain conditions in the US workforce. And so in this study, they found that 13% of the total workforce experienced a loss in productive time during a 2-week period due to a common pain condition. And headaches was one of the most common reasons for pain, resulting in lost productive time, and it was at 5.4%. And actually, workers who had a headache had a mean loss in productive time of 3.5 hours per week. So based on these results, you can see the financial burden that this might cause on some economies. And so as you can see here, for the United States, headaches can cost this country about $19.6 billion per year. And in Europe, it can cause a loss of about 27 billion euros per year. And again, this is principally from lost working hours and reduced productivity. And then out of all the neurological consultations that we see, about 1/3 of them are due to headache. Headaches are the most common disorder of the nervous system. And unfortunately, worldwide, a minority of people with headache disorders are actually inappropriately diagnosed, and headaches are underestimated, under-recognized, and undertreated throughout the world. And there's 3 different reasons that I want to talk about today that are barriers to effective care for headaches. One of that is a lack of knowledge among healthcare providers, and principal clinical barrier. In some conventional programs, medical programs, they're only spending about 4 hours talking about headaches and its causes. It's a little different for us naturopaths. We talk about headaches in many different classes as we approach them differently. A lot of you probably have seen one of our naturopaths, but for those of you who are not familiar, we get education in pharmaceuticals and basic sciences, but in addition to that, we're also very well trained in botanical medicine. So we're learning about herbs that are effective for headaches and different conditions. We also get training in homeopathy, high velocity adjustment similar to chiropractors, and hydrotherapy and different and IV therapy, as you guys know, and then diet and nutrition. Other barriers are poor awareness that extends to the general public. So headache disorders are not normally perceived by the public as a serious problem since they don't happen very often or they're episodic. And they don't normally cause death and are not contagious. And so I think that a lot of people or the general public is really like, well, this is not a big deal. So I'm just gonna work through this pain and take some over-the-counter medications to alleviate my headache. And so oftentimes people are not even going in to see their healthcare practitioner to get properly diagnosed. And then the last barrier is that many governments seeking to constrain healthcare costs don't actually acknowledge the substantial burden of headache on society.
So this slide is talking about the different presentations of headache and then also migraine. And I just wanted to go through it so that we can talk about some of the signs and symptoms of what folks experience if they're having head pain. So with migraines, the pain is often moderate to severe. It's often described as throbbing and pounding. It's usually on one side versus both sides of the head. And there's more of a systemic effect. So people are sensitive to light and to sound and to smells. There can be vision interruption, meaning you can have loss of vision in part of your visual field. You can have nausea, vomiting, or an upset stomach. You can experience dizziness, and you can experience an aura, which is things like flashing or shimmering lights, zigzagging lines, or stars. Then we have cluster headaches, which is considered to be more of an intense pain. It's often described as burning, piercing, and constant. It's also usually on one side of the head and often located behind the eye or in the eye area. And the pain is considered to be clustered in the way that it usually occurs at the same time of day. Then we have sinus headaches. That is more of a moderate pain. It's often described as deep, constant, and sharp, and it's located where the sinuses are located. So in the forehead, up in the cheekbones, bridge of the nose, basically the upper face. Other symptoms that you might experience can be some facial swelling, fever, runny nose, ear pain, because it's usually due to some type of infection in the sinuses. Then there's tension headaches, which are more mild to moderate pain. The pain is described as constant pressure or a band-like squeezing sensation. It's located in the front, sides, or top of the head. And it's usually present on waking. There can be some mild sensitivity to light and noise. And other symptoms that go along with that can be neck and shoulder pain, because oftentimes the neck and the shoulder pain is what's sort of causing the head pain. And then you can also feel irritable, have difficulty concentrating, and fatigue.
So I'm going to talk about the tension headaches. So when our muscles are so tight that they cause headaches at the end of the day or during stressful times. So as you can see here in this picture, muscle tension in the face, neck, and shoulders may cause tension headaches. And so there's a lot of different muscles around the head, around the jaw, and then in the neck that can get tight and can radiate and or cause head pain. So tension headaches are generalized. They occur mainly in adults, but can occur in both genders, but are more common in women. The clinical characteristic is pressure, non-throbbing, tightness, aching, worse at the end of the day. Triggering factors are fatigue and nervous strain, and things that are associated with tension headaches can be depression, worry, anxiety, and stress. In this slide, I'm going to talk about trigger points. So many of you guys might be familiar with this, but when muscles get tight, basically a trigger point is created sometimes, in that the muscle fibers are stuck together and they can't release and or relax, and it causes a trigger point and or radiation of pain. So here in this picture, the X's are trigger points and the red areas are where those trigger points are radiating. So for instance, this muscle right here is called the sternocleidomastoid. It helps you turn your neck. It helps you say no to someone or nod your head. And so when this muscle gets tight, you can see, and there's trigger points, you can see that it can cause radiating pain around the eyebrows and in the back of the head. Another thing to note too is that whenever you're having tooth pain on the bottom left here, it can also radiate pain to the temples. And this muscle right here is called temporalis. A lot of people will also have some TMJ, which basically is some jaw pain. And this can be from grinding at night. It can be from stress. And this can also radiate to the head as well. And so, as you can see here, a lot of different trigger points can cause radiating patterns to the head. And so the way that I like to address this is I do it through acupuncture. And so I'll stick needles in these X's. And I was going to show a video, but I couldn't find the video. But you stick a needle in these X's, and basically it forces the muscle to relax and or twitch. And so it resets and it is able to relax and alleviate these tension patterns. Other ways to treat tension headaches are biofeedback, and this comes from a stress standpoint. And so biofeedback helps regulate your heart rate as well as your breath rate so that you can release any tension. Other things that cause tension could be even your pillows and your bed, whether it's too soft or too hard. So sometimes getting a more ergonomic or neck pillow can be somewhat helpful in alleviating the pain in your neck and your shoulders. And then this goes with your computer screen. So right now we're probably spending a lot of time at a desk that's not ergonomic. Maybe we're working on our couches. And so this can cause a lot of tension in our neck and our shoulders and cause tension headaches at the end of the day. Resting is going to be helpful because this helps us, rest and digest, and also helps us alleviate any tension and or stress that we may have. Regular exercise helps as well. And from a Chinese or traditional Chinese perspective, exercise helps move our qi in our blood. And when we're really stressed out and or we have any tension, our qi, which is our energy force, and our blood get stagnated. And the best way to deal with this is movement. Massage is going to accomplish the same thing, as well as help release any tense muscles. Muscle strengthening and stretching is also going to help with releasing that tension as well. And then remembering to have good posture when you're sitting and standing and or sitting at a desk or standing at a desk. Ice and heat are going to be helpful as well. Ice you want to use more in an acute stage, so in the first 48 hours, and then after use heat. Ice is really helpful for alleviating that pain, and heat is more so for bringing blood to that area so that we can help, one, relax the muscles and also bring nutrients to the areas. And you can also alternate between hot and cold as well. And we call that contrast hydrotherapy. So you do about 3 minutes of hot and then followed by 30 seconds of cold for 3 rounds. And you can easily do that in the shower. Naturopathic manipulation, which is very similar to chiropractic adjustments. A lot of people don't know this, but naturopaths are also trained in doing high velocity adjustments. We can do this via an activator and or a manual release. Acupuncture, which I mentioned, is also really helpful for treating tension headaches and relieving any tension or stress. So also we can do trigger point injections as well. So instead of using an acupuncture needle, I would inject some type of solution like procaine or dextrose into the trigger point to help with relieving muscle tension. And then some of you may have had this already, but neural therapy is another way to also relieve some tension. It's injecting procaine in certain areas of pain to help with vasodilation. So that's dilating the vessels so that blood and nutrients are going into that area to help heal whatever injured area and or tight muscle. And it also helps reset the nervous system as well, so that we're not tense and that we're more relaxed. So the next thing that we're going to talk about is migraines. So there's many different reasons why we get migraines, and the physiology is really, really complex. So bear with me. This is a pretty complex explanation, but I'm going to try my best to keep it somewhat simple. But the cortical spreading depression is the reason why we experience visual auras and head pain. And this is a wave of electrical changes in nerve cells that pass along the cerebral cortex, and they can activate the trigeminal nerve and in turn cause central sensitization. It's a very difficult word for me to say. So what ends up happening is that you get an electrical wave that spreads across the brain here, and it can activate the trigeminal nerve, which is these blue lines here. And when these nerves get activated, it can cause pain in that area. So it is now thought that in many, if not most patients, a wave of electrical activity, which I said, passes through the nerve cells, stimulates the release of peptides and other substances that causes inflammation, makes nerve fibers more sensitive to pain, and causes blood to dilate. And this phenomenon also explains why people who have migraines can complain of visual auras. So they're seeing halos in their eyes and or being sensitive to sound, feeling nauseous, and even light. And it's because there's an electrical wave that's occurring across the brain that's making all of our nerves very sensitive to any input. So there's various different provoking factors that cause migraines, and Dr. Paroo will get into some of these in detail. And so stress can be a provoking factor. Migraines are generally more common in females, and that could be just because we are very hormonal. Not eating can cause migraines, change in weather, sleep disturbance, perfume or odor, neck pain, which we talked about, and tension headaches can cause a migraine, lights, alcohol, smoke, sleeping late, heat, food, exercise, and sexual activity. Oh yeah, I just did. Okay, hold on. Two seconds. I'm trying to unmute Dr. Paroo. I'm sending you an, oh, there you go.
I got it. Sorry, clearly I'm having some technical difficulties. Muting situation. Okay, so hormones and headaches. There are various hormones that we all have that can contribute to headaches and migraines as far as them being a trigger. So thyroid imbalance, and usually if somebody is having more of a sluggish thyroid, so their thyroid is under functioning, there's a correlation with that and being more or having more of a propensity towards headaches and migraine. Mechanism isn't quite known, but there seems to be a correlation there. If you have blood sugar imbalances and therefore balances in insulin, whether your blood sugar is running too high or too low, both of those can be triggers for headaches or migraines. And it seems as though women, as Dr. Murella suggested, are more likely to suffer from headaches and migraines than men are. And one of the mechanisms as to why that is because we have more estrogen, and it isn't specifically the estrogen in and of itself that it's the problem. It's more the fluctuations in estrogen. And so if we look at times in a woman's life where there's more fluctuations in estrogen, it's when there is the onset of a girl or woman's period, which is menarche. Then there is the time prior to menopause, which is called perimenopause, where there's a lot of fluctuation in hormone. Those two times seem to be the most, the times when women are most prone to getting headaches and migraines. And then if you look at pregnancy, besides the first trimester, when a woman gets along further in her pregnancy, and in menopause, when hormones are sort of, you know, there's a diminishment of hormone, but they're kind of in their most balanced state, that is a time where women can have a significant decrease and or their migraines disappear altogether. So then we look at what's happening monthly, because there's fluctuations with hormone monthly for most women, and 60% of women that suffer from migraines, they're said to be menstrual migraines. And again, this is because of the fluctuations in estrogen. Next slide. So this is the female menstrual cycle, and you can see the first phase there, day 0 to 14, is called the follicular phase, and then the second phase, day 14 to 28, is the luteal phase, and in the middle there is ovulation. The yellow line is the estrogen, and the green line is the progesterone, and it seems as though most women are susceptible to getting menstrual migraines with the drop in estrogen. So right after ovulation and right before they start their period or start bleeding. Next slide. So when it comes to treatment for menstrual migraines from a conventional perspective, usually it's going to be pharmaceutical, whether that's going to be at the time of the migraine, or if they might suggest getting ahead of it. And if you know that you're prone to menstrual migraines, to kind of time the medication a couple days or a day or so before you expect to get it. And then there's also hormones. So a common treatment is to put women on birth control, because that is going to even out hormones and not have as much fluctuation in hormone throughout the month. And during a woman's menstrual, during the woman's period, there is actually no hormones that are given. Even when you're taking the birth control, during the time when you're supposed to be bleeding, they give you blanks. So there's really no hormone in there. But if you're prone to migraines, there's a treatment where they continue with putting you on the hormone throughout the whole cycle, so that you don't have that fluctuation in hormone and therefore don't have the trigger. From a naturopathic point of view, we like to look at the whole person and not just sort of treat the symptom. But when it comes to menstrual migraines, there's ways of balancing the hormones so that you are less susceptible to the triggers, which again is that fluctuation in estrogen specifically. Then we look at supporting the nervous system, because, you know, the mechanism for these menstrual migraines isn't just about hormonal imbalance. There's a lot of factors that go into these triggers. So trying to support the nervous system so it's just less reactive. Looking at diet and lifestyle to make sure that there isn't influencing factors there. Treatments such as biofeedback, stress management techniques, and acupuncture all can be really helpful for managing menstrual migraines. So then we look at food and headache and migraines. And there are a number of foods that have been implicated in triggering migraines and headaches, as well as additives and different beverages, and the mechanism is somewhat unknown, or it's unclear, but there are a few theories. And one of them is the amine hypothesis. So amines are chemical compounds, and they're produced from certain amino acids in food, and they may contribute to headaches in certain people. So examples of this, examples of amines are histamine, tyramine, phenylethylalamine, and those are big words, and you don't need to remember those. It's just, they're formed from amino acids which are naturally occurring in the food. So certain foods such as tomatoes and avocados and spinach naturally contain higher amounts of histamine and or tyramine, and dark chocolate, unfortunately, contains phenylethylalamine. So in general, amines are highest in foods in which bacteria break down the amino acids, such as during fermentation or as the food ages and ripens and spoils. So examples of that are alcoholic beverages, fermented vegetables like sauerkraut, processed meats, aged cheeses, soy sauce, and some fish. And most people eat such foods and they don't have a problem with them because we have enzymes in our gut that help break down the amine. But if you have a deficiency in that enzyme, the enzyme is called diamine oxidase, and you can't break down the histamine, then you could be more prone to getting migraines or headaches. Next slide. So another explanation of how amines can contribute to migraine is looking at tyramine. And so again, certain foods are higher in tyramine, like avocados, and the tyramine acts with other compounds in our blood to start a chain reaction that causes imbalances in some neurotransmitters, which are brain chemicals. And so then the altered biochemistry, along with other compounds that may be present, make somewhat of an inflammatory soup. And folks that already suffer from migraines tend to have more of an excitable nervous system. So this soup may exceed the individual's migraine threshold, and it results in an attack. Next slide. Then there's the idea of reacting to food or being sensitive or allergic to some of the compounds in food that could trigger a headache or migraine. And we've talked about leaky gut in prior conversations, but to review, in our gastrointestinal tract, there are cells, and those cells should be tight, meaning they are stacked up against one another and there's no space in between them, and that space is called the tight junction. Sometimes, if that junction becomes leaky for whatever reason, we call it leaky gut, and then bigger proteins or microorganisms and or toxins can get through that leak and into the bloodstream. And if there is, for whatever reason, leaky gut going on, again, this is an opportunity for larger food proteins to get through, and our body sees those as foreign, mounts an immune response to this, and the end result symptomatically can be a headache or migraine, amongst other symptoms. Next slide. So it can be difficult to figure out if food is causing your headache, because you can eat a food and have a headache 20 minutes later, or you can eat a food and 10 hours later have a headache, and so it's difficult to sort of trace back the causative factor there. And so having a diet diary and a headache journal to kind of track what's happening can be very helpful, so that you can at least try to isolate what the causative factor can be. Some options to investigate this further would be to get an allergy test. And so it's looking to see if food is causing an immune reaction, again, which is potentially triggering a headache or migraine. And we do a form of testing that looks at a few different parts of the immune system. And this can be helpful because it casts a wider net than the traditional allergy testing, which only looks at an immediate response of the immune system. And we're also looking at the delayed response. So another way to investigate if food is a causative factor for headaches is engaging in an elimination diet. And an elimination diet is actually the gold standard for figuring out food allergies. And that involves eating a specifically restricted diet for a certain amount of time, and with the intention that whatever symptom that you're experiencing, be it rashes or fatigue or headache and migraine, go away. And then you add the food back in slowly, one at a time, to see if that indeed was the trigger. And so that is a way to also figure out if food is a contributing factor to to headache or migraine.
Okay, So this is the part where I talk about what the Chinese or traditional Chinese medicine perspective is of headaches and migraines. And it's a lot more simpler than Western medicine, which is why I love Chinese medicine, because it just makes sense. And so as you can see in this picture here, there's different types of headaches, and qi and blood move towards the head. And so whenever qi or blood is blocked in the meridians, it can cause a headache. And so a Tai Yang headache is an occipital headache. A Yang Ming headache is a frontal headache, and is associated with the stomach channel. And so if someone were to say, oh, I have a headache and it's in the front of my forehead here, I would start to think, okay, how is digestion? Do you get reflux? Do you get any gas or bloating? Here is the Shaoyang headache, and these are temporal headaches that are associated with the gallbladder channel. And so I would ask about stress, because when we are really stressed, our liver is what absorbs all that. And so we can oftentimes see that people will complain of temporal headaches, and the liver channel actually runs here with the gallbladder. So liver and gallbladder are always paired together. Tai Yin headaches, those are associated with dampness, and that's associated with the spleen channel. And so the spleen is in charge of digestion in Chinese medicine. It's very similar to what our stomach does in Western medicine. And it's also, it also gets rid of dampness. And Chinese medicine thinks of dampness as basically like what we see on a rainy day in Seattle. So dampness can be from greasy foods, it can be from damp weather, fatty foods. And so when our digestion isn't working well, or our spleen in Chinese medicine isn't working well, we can get an accumulation of dampness. And some people, they will then get a Tai Yin headache. Shao Yin headache is from a toothache, and Jui Yin headache is a vertex or top of the head headache. This type of headache can actually be associated, the Jui Yin can be associated with liver yang rising. And so in Chinese medicine, you have your yin and your yang. And so your yin is your cold energy, your yang is your hot energy. As we age, our yin starts to deplete. And so we have more of that hot yang energy. And so oftentimes when people are going through menopause, they will complain of hot flashes, and they're starting from the bottom and moving up towards the head. And this is more of that Jui Yin. So the yang is rising and causing a heat flush. So headaches in Chinese medicine can be caused from exogenous factors as well as endogenous factors. So in this slide, I'm going to talk about the exogenous factors. And so these are more acute onset. So they're oftentimes associated with colds or allergies, and they're pretty simple. So it's either wind cold, wind heat, and wind damp. And the symptoms really correlate to the name of the type of headache. And so with wind cold, it's common in cold weather. A patient will experience upper neck stiffness, and obviously if there's too much cold, they're not going to like cold. In wind heat headaches, you'll get fever, sore throat, aversion to heat, and with anyone who's running too hot, you would expect them to have a red face and red eyes. In wind dampness, a patient may complain of muffled pressure or a towel wrapped around the head. This is very similar to maybe a sinus headache in Western medicine. They'll also complain of heavy sensation in limbs and or chest, and they'll also have poor appetite. So remember, we talked about that spleen being in charge of digestion. And so if there's too much dampness, then the spleen is not able to work at its highest potential. And so in this instance, you might have some poor appetite. There might also be some congestion in this picture as well. And so the endogenous patterns, there's a lot more. And so it can be either from that liver yang rising, which we talked about, liver fire, phlegm damp, blood stagnation, qi and blood deficiency, and that kidney yin deficiency. And so liver yang rising and liver fire, they're very, very similar. Liver yang rising can be a little more severe than liver fire. And so with liver yang rising, remember we want a balance between our yin and our yang. And so as we age there's many different reasons why we can have yin becoming deficient. But when yin becomes deficient, then we have too much of that hot energy and it's not grounded, and so then it can arise. And so this patient might complain of a red face because the yang is rising. They might also complain of anger, irritability, and nightmares. And then in liver fire, it's not as severe, but this patient will complain of red eyes and irritability. And the way that I like to remember this is when I'm running super duper hot, I'm usually very irritable because I'm really, really hot. And I also can get a little red and a little angry. And then there's phlegm damp. So remember with damp, the way I like to remember this is a rainy day in the Pacific Northwest, which is you're usually kind of feeling sluggish, a little heavy. And so this patient will complain of pronounced sensation of heaviness because of that dampness. It's worse in damp weather, so rainy weather. And then with too much damp, it can start to kind of miss the mind or the brain. And so a patient might also complain of some dizziness. Blood stagnation is mostly from trauma. So I think of it as if someone got hit in the head, or if there was any type of trauma that happened. And so this person will complain of fixed, severe pain. And again, it's associated with trauma. Qi and blood deficiency. And so your qi is your vital force. It's what gets us through our day. It's our energy that gets us through our day, and our energy that our organs use to function. And so as you might imagine, when we work too hard or maybe we're stressed, our qi and even our blood can become deficient. So this scenario would happen in a stressful environment when we're too tired and or overworked. Because of blood deficiency, you might also experience some palpitations because there's not enough blood to supply to your heart. And so your heart is kind of fluttering. You might also have some poor memory because there's not enough blood getting to your brain, and so it's not functioning as well. And then it can be worse after menses. And then there's kidney yin deficiency, which we talked about. This is often happening as we age. And so a patient might complain of weakness and or pain in the low back and or knees. There might be some fatigue and then night sweats. And remember, that's because you have too much yang in comparison to your yin. So we've come to the end of our slideshow. It was a shorter presentation. Just want to say thank you guys again for checking in with us. It's always a joy to do these presentations for you. And then if you want to check us out, this is our Instagram, and then this is our website. And then if you have any questions, feel free to send a message, and or I'm going to also try to figure out how to unmute everyone so that you can unmute yourself if you want to ask a question. Okay, so you can do that now. Dr. Darvish wanted me to just send everyone a reminder to watch for Holistic E-News. Our next webinar will be Friday, June 10th at noon.
It's July 10th. July 10th.
Oh, sorry, July 10th. July 10th at noon. And we're going to try our best to keep doing these every second Friday of every month. And you can also sign up for our newsletter at holistichealth.com, which is on our website. And then Dr. Marion and Dr. Darvish will be on Facebook Live and Instagram Live tomorrow, right, Dr. Paroo? Yes.
Tomorrow.
And they will also be doing a conversation about headaches.
I think they're actually doing it about women's health tomorrow.
Oh, maybe it'll be on women's health.
Yeah, I think so.
There is a question here on CBD. We can talk about that, right, Dr. Paroo?
Yeah.
Okay, so CBD can be very helpful for people, more so because it's bringing down that inflammation. CBD has an anti-inflammatory effect. Some people might find that they need a little bit of THC to take the edge off so that they are no longer experiencing that pain. Do you have anything else to add to that, Dr.
No, I really
Paroo?
don't have too much to say about it, unfortunately. I don't feel like that I'm super well versed in it. So
yeah. And then another question we had at our last presentation on this, I'm going to stop sharing this. So, okay, was what are the severe signs or the red flags that are associated with headaches? And so the ones that are associated, the red flags are going to be obviously the trauma signs. So if you do get a headache after trauma, if you start to experience any bruising around the eyes and or behind the ear, you want to go to the hospital. But also if you're getting any loss of vision as well, specifically peripheral vision, you want to get checked out. And then if this is kind of like worst headache of your life and you're experiencing any nausea, visual issues, flashes of lights in the eyes. Anything else, Dr. Paroo?
I think that you covered it.
And then another thing I wanted to highlight too is just going back to the first slide, which is that oftentimes us as working class Americans, we are just trying to get through our everyday life and we suck up things that we probably should not suck up. And so being more preventative about your headaches and or any symptoms that you're having can be really effective. And so even though it might not be severe, it still warrants you to come in and get it checked out and see if there's anything that you can do now before it gets worse. Okay, if there's no more questions, thank you guys again. And I hope that everyone has a safe 4th of July, which is in 2 weeks, but also a great weekend. Thanks, everyone.
Thank you.